Hi everyone, thank you for joining us tonight on another episode of the Egg Whisperer Show. Tonight's episode is on the 5 things everyone should know before, during, and after IVF. This is how I think about it. When you're doing an IVF cycle, you can never be too prepared. You can't be overly prepared, and everyone should be in the know. So the first thing that I think everyone should know is why. Why are you doing IVF? What are the fertility factors that are playing a role in your case? And the reason why that's important is that if there's something that you could possibly do to improve your chances, wouldn't you want to know that before you actually started your cycle? I'll give you an example. For example, let's say you're dealing with a sperm factor. 50% of every embryo comes from a sperm cell. 50% comes from an egg cell. So if there are issues with the swimmers, believe it or not, it's true. Having good sperm does make a difference. So if a guy is taking supplements, eating right, drinking less, avoiding other toxins like marijuana, cigarettes, things like that, that might give you a better chance with your precious eggs. So find out the why and do everything possible to give yourself the very best chance, get into the best shape of your life, and take advantage of the IVF cycle as an opportunity to learn as much as possible about your personal health, so that when you go through your cycle, you also have not just the best chance of pregnancy, but also the healthiest pregnancy. The second thing I like all my patients to know about before, during, and after their IVF cycle is how relationships can change. We know this all too well from the story of Dr. Mimi Lee. And this is a story of a wonderful woman, also a doctor, who went through IVF with someone that she was engaged to and eventually married. Their relationship changed, and then they got into a dispute over embryos. I've seen these disputes. They're not always in the news, though, where couples get divorced. And a woman, as we know, we run out of our chance to have pregnancy, most of us in our early 40s. And if you're divorcing and you want a second child, guess what? You may not have the opportunity to have that child because you guys agreed that if you were to split up, you wouldn't use the embryos or those precious cells would get discarded. So if you're in a situation where you're having doubt about your relationship, please make sure that you realize that your IVF consent forms are a form of a legal document. If you have any doubt about the status of your relationship, go to counseling. Seek assistance from not just a counselor, but an attorney to help you draft a type of IVF consent form that is acceptable to you. And if you feel like your relationship's on shaky ground, hold off on going through the cycle. And what I tell people to do is consider doing an extra cycle. If you're not quite sure but you still want to move forward, do a cycle where you freeze eggs for you, just in case something happens in the relationship so that you still have options in the future down the road. So that goes along with this third thing that everyone should know. And when you're going through IVF, this third thing seems like the last thing everyone wants to think about or talk about, and that is having unused embryos. When I meet with my patients, I always ask them, 1, what do you think the problem is? And 2, how many kids do you think you want? And most people look at me like, I have 2 heads, because they always say, I would be so happy if I could have at least 1 child. But I know that when patients go through IVF, they end up with extra embryos. And how you feel about those embryos, it changes over time. And once you actually become a parent, you actually realize what those embryos mean to you. And what they mean to you as a parent is so different compared to what they meant to you when you were thinking about having at least 1 child. So talk about those things with your partner before you go through IVF. Talk about what would you do with unused embryos. Would you donate them to another family? Would you want to discard them? Would you want to donate them to science? And we heard of that pretty amazing story not that long ago about an embryo that was born after 20 years of being frozen. So we know that embryos don't get freeze or burn. So be sure to think about these things, because once you've discarded or destroyed an embryo, that decision is irreversible, but it can potentially help another family or maybe move science further along. So the fourth thing, and I think this is really, really important, is that pregnancy isn't always easy. And so when you've had a really hard struggle, most of us feel really guilty about complaining about pregnancy, about feeling awful, about being sick, about being emotional. Pregnancy is not always enjoyable for a lot of people. They don't feel like these sexual goddesses. They don't feel beautiful, and they don't feel like they're glowing. I like to think that all my patients look absolutely gorgeous pregnant, but my patients sometimes don't feel the same. And so the depression and anxiety that a lot of patients carry as they go through fertility treatment, it's not unusual to carry that in pregnancy. So it's really important to have a team, have a fertility therapist, make sure you're in a good spot with your partner, and if not, seek therapy, seek help. And there are a lot of books out there, and I'll post one along with this video, about how to cope with anxiety and depression in pregnancy. So if you're feeling that you're feeling guilty for hating every minute of pregnancy, I can tell you, you're not alone. It does get better, but sometimes it doesn't for some people. And sometimes those feelings actually don't go away after you deliver. And sometimes, and I'm going to go on to number 5, and number 5 is that those feelings that you had when you were having a hard time getting pregnant, they can sometimes continue after pregnancy and beyond. Even if you've gone through IVF and it doesn't work, years later, the trauma of the treatment that you went through can continue. So let's say you were successful with your IVF cycle. It isn't unusual to still feel pangs in your heart when someone announces their pregnancy. You can be happy for your friend, but you can also still be sad that you had to work so hard to get pregnant. And that's totally okay. So what I tell my patients, those feelings are totally normal. So I want people to know that they're not alone when they're feeling like that. So these 5 things are important. Figure out why you're doing IVF. Make sure your relationships are solid. Realize that you may have unused embryos, and you should talk about what you're going to do about those ahead of time. Pregnancy isn't always a fun ride. And the 5th thing is that the trauma from failed treatments and even treatments that have worked is real. So work your feelings out, talk to a therapist, and as always, talk to your doctor. So I hope you learned a lot from this show tonight, and I hope you'll join us next week also. Hope to see you soon. Have a great night.